Good afternoon, good evening, everyone, depending on where you are connecting us from. Welcome to the global launch event of the FIP Pharmacy Education in Sub-Saharan Africa report, showcasing a decade of education partnership across Africa. Thank you for joining us live today, and thank you to those who is going to watch this recording afterwards. Please let us know by typing into the chat box from which country you are connecting us from and which area are you practicing as a pharmacist, and whether you're a pharmacy student or if you're a friend of a pharmacist. I would like to warmly welcome our speakers, panelists. At this global launch event, we are together with the co-authors of the FIP Pharmacy Education in Sub-Saharan Africa report and healthcare, pharmacy and education leaders across Africa and beyond, including guests from UNESCO and World Health Organization Regional Office for Africa. This global launch event will be chaired by FIP-UNESCO UNITWIN Director Professor Ralph Altieri, whom I'll hand over to shortly, and facilitated by myself and FIP UNITWIN Coordinator Alison Williams. I would like to thank to both of them for their support in making this event happen. My name is Nilhan Uzman. I'm the lead for education policy and implementation at FIP. I'm a pharmacist trained in Turkey. I'm leading FIP's UNITWIN program, which we will introduce to you at this event. I'm one of the co-authors and co-editors of the FIP Pharmacy Education in Sub-Saharan Africa report. Before we start, I would like to share a couple of logistics with you for today's webinar. This webinar is currently being recorded, and we are also live on Facebook. The recording will be available at FIP's website. We posted the link here, but we'll be sharing this link throughout this event and after the webinar with you. Please share your questions by typing them into the Q&A box. We will be picking up these along the discussion today. And we invite you to join the discussion today and the conversation. Please use Pharmacy in Africa, FIP in Africa, and Pharmacy Education hashtags on your social media. We will invite you to share your actions from your country at a poll today. So please watch the poll and join the discussion there as well. And finally, we welcome your feedback for us to improve our events. And please contact us at webinars@fip.org. Today, we are celebrating the global launch of the FIP Pharmacy Education in Sub-Saharan Africa report. This is a first of its kind report on pharmacy education in FIPs and African history. The report showcases a decade worth of evidence from FIP-UNESCO UNITWIN Center for Excellence in Africa and countries across Africa. The report describes the needs and priorities of pharmacy education in sub-Saharan African countries with a focus on academic capacity, needs-based education, as well as advocacy for advancing pharmacy education and the profession. This report has been co-created by pharmacy schools that were part of FIP-UNESCO UNITWIN Center for Excellence in Africa, FIP members across Africa, African Pharmaceutical Forum, IPSF, FIP-YPG, and supported by WHO Regional Office for Africa and UNESCO. Today's global launch event is consisted of two parts. At part one, the report's co-authors will present the chapters and the findings of the report. And in part two, healthcare, education, and pharmacy leaders will discuss and commit to action to address the findings of the report. At the end of this global launch, you will get an overview of pharmacy education needs, priorities in sub-Saharan Africa, with a focus on needs-based education, academic capacity, and advocacy. You'll learn about FIP's UNESCO UNITWIN Center for Excellence in Africa. You'll take on practical ways to address way forward areas based on the findings from the report. Please join the discussion again, as I mentioned, on social media about today's launch event and the report, and don't forget to use Pharmacy in Africa, FIP in Africa, and Pharmacy Education hashtags, and also tag FIP. That's all from me. Now I'm pleased to hand over to our chair and moderator for today's global launch, the FIP-UNESCO UNITWIN Chair and FIPED Chair, Professor Ralph Altieri. Over to you, Ralph.
Thank you, Nilhan. And hello to everyone, and welcome to this special event of the launch of this report on pharmacy education in Sub-Saharan Africa. And thank you all for joining us for this momentous occasion. As Nilhan mentioned, this report describes the work of many individuals who have the passion and the commitment to advance pharmacy education in Africa, to build a workforce that's needed to respond to the health needs of their communities, their countries, and the entire continent of Africa. As you will see, once the report is launched, it became a much larger project than we had at first anticipated, and really gives a really good comprehensive look at pharmacy education in Sub-Saharan Africa. So we're pleased that you've joined us today to be a part of this event, and we look forward to your questions and your input later in the program, as Nilhan had mentioned. It's now my pleasure to introduce Dominique Jordan, who is a community pharmacist in Switzerland and the president of FIP, who has injected new energy and new ideas into FIP. He'll give us a brief introduction to the new directions for FIP that include strong support for the work that we are launching today. So Dominique, over to you. Welcome and thank you for joining us.
Thank you, Ralph. Dear colleagues, it is my privilege to join today at the virtual, sorry, I have a problem with my video. Like this is good. So I said it's my privilege to join today at the virtual launch of FIP's report on pharmacy education in Sub-Saharan Africa. Building on decades of experience with the FIP-UNESCO UNITWIN Center for Excellence in Africa, I am proud to share the outcomes and country impact, significant amount of evidence and best practices achieved together with our colleagues across Africa for advancing our profession through transformations in pharmacy education. The role of education is at the center in advancing our profession to meet the needs of the population. Because there is no health for all without workforce, and there is no pharmaceutical workforce without pharmaceutical education. Academic pharmacy leaders and pharmacy educators are accountable for building a competent, flexible, and adaptable pharmaceutical workforce while shaping pharmacy and pharmaceutical sciences education by anticipating the emerging and increasing needs of the health systems, new trends, and societal challenges. In 2016, FIP has developed a global vision for education and workforce, the Pharmaceutical Workforce Development Goals and Nanjing Statements in Nanjing, China. We must have the right education for our current and future pharmacists, and these has been vital tools for universities and schools of pharmacy in anticipating the challenges ahead. This report is a great example of showing how our pharmacy colleagues across Africa have contributed to the development of these tools and how they have utilized to draw a comprehensive picture of needs and priorities in pharmacy education in their countries and institutions. We articulated the One FIP approach during the autumn of 2018, and the FIP strategy and imperatives were being agreed. FIP supported the WHO's Astana Declaration and overtly promoted the role of pharmacy as essential to deliver primary health care globally, and as such, ensure progression towards universal health coverage. To achieve these aims over the coming decade, there was a renewed focus at FIP. First, the need for FIP to support members, organizations, science organizations, academic institutions, and individuals to be enabled and empowered to achieve their role in universal health coverage. Secondly, the need to identify the priorities in country and across regions that were relevant to the pharmaceutical workforce at every level. Third, the need to articulate the goals for the next decade that would enable us to deliver these ambitions. And fourth, the need for us to support developments, make bridges between our organizations, and enable the sharing of learning and best practices and to evaluate this progress through data and evidence. Therefore, last month, we have launched the FIP Development Goals, building on the FIP Pharmaceutical Workforce Development Goals, ensure that a systematic, integrated framework can facilitate the needs-based transformation of pharmaceutical practice, science, and workforce and education. With the FIP Development Goals, FIP is set to transform global pharmacy working in partnership and collaboration with our members everywhere. FIP is committed to support you all to implement these goals. With trust, solidarity, and action, we can transform pharmacy together. While we were working to deliver this important report, the world has been amid COVID-19 pandemic. There has never been such a period to date in the recent history where the world needs health for all and universal health coverage more than ever. We witness heroic work from our pharmacists around the world, and every country and region is facing distinct challenges in practice, science, and education to combat COVID-19. The time has come to narrow the gaps between the different regions of the world in a pragmatic way. We started our FIP UNITWIN journey with Africa and uniting under the one FIP vision, a world where everyone benefits from access to safe, effective, quality, and affordable medicines and pharmaceutical care. I am delighted to share that for the next decade, FIP will continue supporting African pharmacists and pharmacy education in a sustainable way while we move to the next regions in the world to continue transforming pharmacy education in collaboration with our colleagues in UNESCO. We have created the vision, and now it is time to be one FIP and deliver with trust, solidarity, and actions the changes required for the needs of people and societies across our globe. I am convinced that if we continue our efforts towards supporting the transformation and development of pharmacy education globally, we build a bright future for our profession and patients. Long live pharmacy, long live FIP, long live African pharmacists. Thank you very much, Ralph. Back to you.
Thank you so much, Dominique, for those great introductory remarks about FIP and its connection with this program that's in Africa and beyond, all the other things that FIP is doing right now. So for anyone who's not a member of FIP on this call, you should join us. It's a pretty exciting time.
It is.
So as Dominique alluded to in his remarks, FIP development goals provide a systematic integrated framework that can facilitate the needs-based transformation of pharmaceutical practice, science, workforce, and education. And within that, FIP has two primary transformation programs with the purpose of transforming education and workforce to meet population needs and improve global health. And those are the Education Transformation Program and the Workforce Transformation Program. This report focuses on the FIP-UNESCO UNITWIN Program and its Center for Excellence in Africa, Education Transformation Program in Sub-Saharan Africa, with the purpose of responding to the historically large deficit of the pharmaceutical workforce in Africa by building workforce capacity to advance pharmacy practice to better serve their communities' healthcare needs. As such, the Center for Excellence in Africa and UNITWIN serve as a platform for implementing the FIP Education Transformation Program, which is the future of the UNITWIN program, building on a decade of experience in Africa, as we will learn in this report. The purpose of this report is to provide an overview of the needs and priorities of pharmacy education in Sub-Saharan Africa, with a focus on academic capacity, needs-based education, and advocacy for advancing pharmacy education and the profession. The report highlights the most challenging and pressing needs in Sub-Saharan Africa in terms of healthcare and societal needs, and publishes a decade of evidence from the UNESCO UNITWIN Center for Excellence in Africa, and how pharmacy education and pharmaceutical workforce have responded to these challenges through networking and collaborative efforts. And this defines UniTwin, or the university twinning, and develops strategies to educate the future pharmaceutical workforce. In addition to these ongoing challenges, the report also addresses 4 special focus areas of critical importance: the role of students and young pharmacists in helping to shape the future of pharmacy education and practice, quality assurance programs, equity in education and science, and strengthening the inclusion and role of women in science and education, whether they be students, pharmacists, or faculty members. And of course, as Dominic alluded to, how the Center for Excellence schools have responded to the new challenges that have been thrust upon them and all of us, and that's the COVID-19 pandemic, which has exaggerated the inequities that were already present. The report also provides recommendations and a way forward for building on the success of the Center for Excellence in Africa, and how this model developed in Africa can be extended to other regions of the world through the global UniTwin program. If we could have the next slide, Nilhan. So as you can see in this slide, the report is co-authored and co-created by many individuals from the pharmacy schools that are part of the FIP-UNESCO UNITWIN Center for Excellence, by FIP members across Africa, the African Pharmaceutical Forum, the International Pharmaceutical Student Federation, the Young Pharmacists Group of FIP, and supported by the World Health Organization Regional Office for Africa, and UNESCO, in collaboration with University College London and the UK National Commission, who forged the original agreement to form the FIP-UNESCO UNITWIN program. And of course, our thanks to FIP for its support over the years. So thank you all for your contributions to this major piece of work. I also express my thanks to my colleagues in the Center for Excellence in Africa for their commitment to change and to advance pharmacy education. This report would not have been possible without their work, not only in writing these chapters for the report, but for all the work they've done over the years to bring us to this point. And I want to provide special thanks to 2 people: Nilhan Usman, who is our FIP lead for education policy and implementation and our program lead for UNITWIN, and Allison Williams, our project coordinator, who's working on a volunteer basis for the UNITWIN program and the Center for Excellence in Africa. I want to thank them for their daily efforts in supporting and managing the Center for Excellence, organize this report and the launch event today, and all the work they've done over the years to bring us to where we are today. So superb work, Nilhan and Allison, thank you very much. So that ends our introductory remarks, and we're now going to go into part 1, which is the launch of the report. And Nilhan will start us off with a background to that report. Nilhan, over to you.
Thank you, Ralph. And also thanks, Dominique, for your introductory remarks. So we will present the findings from each chapter of this report today, but to set the scene, I will start with sharing the consolidated findings from each chapter that made up the recommended actions from the report. African countries will need to anticipate and build a flexible and productive workforce to meet existing and future societal and healthcare challenges through regional or national strategy for education and skills development, supported by adequate investments and funding. Pharmacy regulators and professional pharmacy organizations need to step up measures in countries and advise governments to address workforce migration and shortfall issues. As in other parts of the world, implementing needs-based pharmacy education strategies are key to meet specific societal and healthcare needs in Africa. We will have a focused discussion on how to address inequities in healthcare and education in Africa, and the added value of establishing educational partnerships at our panel today. When we looked at the wider societal and healthcare needs in Africa, we identified that there is a severe shortage of health workers in Africa. As one of the most accessible healthcare providers, pharmacists have an integral role to play in meeting the healthcare needs across Africa. In order to relieve the burden on fragile health systems in the region, the development of a robust health workforce through needs-based and quality education is key. FIP is committed to provide its experience and resources to identify needs and priorities of pharmacy education and the profession and address them systematically. Ralph, I guess you're on mute.
I have to unmute myself, yes.
Yes.
Our next speaker is Khalid Garba Mohammed. He is a registered and licensed pharmacist in Nigeria and has practiced hospital and community pharmacy before joining academia. He is currently a lecturer in the Faculty of Pharmaceutical Sciences at Bayero University in Nigeria, and he's completing his PhD work at the University of Milan in Italy. I'm just a little jealous, Khalid. I'd like to spend 4 years in Milan myself.
After COVID, sir.
Yeah. So he is the FIP Young Pharmacist Group Liaison for the FIP-UNESCO Center for Excellence in Africa. So welcome, Khalid. Look forward to your remarks.
Thank you, for the kind introduction. And hello, everyone. Thank you all for joining us on this very important event today. I'm going to take us briefly through a continental tour on pharmacy education status in Sub-Saharan Africa. Based on the key findings from this chapter, despite the rising challenges in pharmacy education in the region in terms of shortfalls of academic staff, insufficient experiential learning opportunities for the undergraduate pharmacy students, poor infrastructure and poor funding for pharmaceutical research in the region, still there is a paradigm shift in terms of the pharmacy training for the undergraduate. That is a change from the product-oriented big Bachelor of Pharmacy program to more of patient-oriented, which is a global trend at the moment. And this is happening in two paces, in two ways. One, the undergraduate program, so that the undergraduate student will graduate with the Bachelor of Doctor of Pharmacy qualification instead of Bachelor of Pharmacy. This is happening in many countries like Ghana, Nigeria, and South Africa. And then through special combustion program. For instance, in Nigeria here, in 2008, there was a program that was initiated by the pharmacy regulators, the Pharmacists Council of Nigeria, in collaboration with the University of Benin and the Association of Nigerian Pharmacists in the America. That is a one-year program. If you have graduated with your Bachelor of Pharmacy, especially for those practicing in the hospital and academic pharmacists in the clinical pharmacy setting, this is in essence to boost the capacity, the academic capacity for the PharmD program that is taking place now to align with the global trend. So still this paradigm is happening and a lot of African countries are emulating this. And then we also found out that to improve the decent working condition in African academic institutions, this will have a lot of significance in terms of stopping the migration of academic capacity or academic manpower to greener forestry, because it has been observed that some academic pharmacists actually migrate to other countries in search of better or remuneration and better working conditions. So addressing this challenge will actually translate into boosting the academic capacity in the region. We also found out that pharmacy education needs in the different countries in the continent actually varies. As I mentioned, some countries already the PharmD is taking place, while in some still the Bachelor of Pharmacy is taking place. So the curricula are different. So the needs for each is a bit slightly different from one country to another. We have also found out that the need-based education can help in closing gaps between what actually the student learn in the university and what they actually practice in reality, because there is this disparity also between what the student actually learn in the region and what in reality is actually obtainable when they to practice. So this gap will help a lot in at least helping the student learn what they need to learn and at least what they need to practice when they graduate. And finally, we have also found out that there is need for intra and inter-regional partnership across the continent in terms of pharmacy education. This is in order to ensure quality and harmonization of pharmacy education in the region. So these are just a key finding in summary. I will encourage all of you to go through the whole report so that you will find it in details, what we have actually found out, so that you can enlighten yourselves. Thank you. Over to you, Nilhan.
Thank you very much.
Yes.
Okay, I'm back. So I will be presenting the findings from the workforce chapter, and I'm presenting this chapter on behalf of our colleagues from the FIP Workforce Development Hub. I want to thank for their contribution. FIP advocates that there is no pharmaceutical workforce without pharmaceutical education. And this chapter reports on findings originally published in 2018 at the Pharmacy Workforce Intelligence Global Trends Report by FIP. And this chapter focuses on pharmaceutical workforce in Africa. And the findings provide a significant contribution to understanding the current and persistent workforce capacity inequities in pharmacy, including country income level and gender, and highlighting the future need to explore implications of these inequities of access to both medicines and the collective medicines expertise of the global pharmaceutical workforce. There has been an increase in workforce capacity in Africa as measured by pharmacist density, although not for all countries. The workforce capacity gap between African countries based on income level is increasing over time, and disparity reveals a significant effect in terms of accessing pharmacists, and that gap will continue to increase in the years to come. Funding pharmacy workforce will influence national health workforce density and economic growth, because pharmacy workforce is the third largest healthcare workforce in most countries. Again, as Khalid mentioned, I invite you to review this chapter together with the whole report as well, as we are just providing you a snapshot of the findings, but the report is consisted of, especially this chapter is consisted of a detailed analysis of pharmaceutical workforce in Africa. I'll continue with the next chapter, as we will introduce you the FIP-UNESCO UNITWIN program and the Center for Excellence in Africa. FIP Pharmacy Education in Sub-Saharan Africa report documents the outcomes of FIP-UNESCO UNITWIN Global Pharmacy Education Development Network, which was launched in 2010 to advance research, training, and curriculum development in pharmacy education by building university networks and encouraging inter-university cooperation worldwide. This program also led to the establishment of a FIP-UNESCO UNITWIN Center for Excellence in Africa. The FIP-UNESCO UNITWIN Center for Excellence in Africa has been an incubator for reforms in pharmacy education. Over a decade, FIP-UNESCO UNITWIN Center for Excellence in Africa facilitated intra-regional academic partnerships and exchanges, joint research, advocacy coalitions, enhancement of quality assurance in pharmacy education, increase academic capacity, and access to resources. I would like to take this opportunity to thank its founders, members for their visionary leadership and commitment. I also would like to thank our UNESCO colleagues who are joining us today for their support, commitment, and support to FIP for being the first healthcare education coalition in UNITWIN network. Now I'll hand over to academic capacity, needs-based education, and advocacy leads from FIP-UNESCO UNITWIN Center for Excellence in Africa, who will represent the main focus areas of this network.
Thank you, Nilhan, for that introductory remarks on the report and the Center for Excellence and its work. So our next speaker is Mariam El Bayaki Gayasi from Ghana. She is a senior lecturer and researcher in drug formulation, delivery, and technology in the Department of Pharmaceutics at KNUST in Ghana. She is the academic capacity lead for the UNESCO UNITWIN Center for Excellence in Africa program, and also is a member of FIP-WISE, which is Women in Science and Education. So welcome, Mariam, and we look forward to your report.
Thank you very much, Ralph. Hello, everyone. Greetings from Ghana. Academic capacity is key to the development of pharmacy education worldwide. And we agree that the availability of highly trained and skilled pharmacists ensures good healthcare delivery. Thus, training of pharmacists is of great significance if the healthcare of the populace in Sub-Saharan Africa is to improve. The abilities, skills, and expertise of educators in pharmacy schools contribute to the building of academic capacity. And so I'll briefly summarize a few key points from the report, which can be downloaded and gone through later. Now, building of academic capacity, as I mentioned earlier, is key for the sustainable development of the pharmaceutical workforce, which will help to improve health and well-being worldwide and in Sub-Saharan Africa specifically. Now, the academic capacity promotes attainment of postgraduate degrees in pharmacy, which will help to increase the academic quality of staff strength and also to improve staff strength. Now, improvement of staff strength will help to increase the student-staff ratio, which currently is substandard. FIP-UNESCO UNITWIN Center for Excellence in Africa facilitates and promotes interactions and discussions for the improvement of academic capacity. Now, through the FIP-UNESCO UNITWIN Center for Excellence in Africa network, FIP continues to engage its resources, expertise, and networks towards transforming pharmacy education in Sub-Saharan African countries, building on the premise that there is no workforce without education. Improvement of academic capacity, as I mentioned, helps to increase staff numbers and improve staff-student ratios, which are quite poor at the moment. Now, while increasing academic capacity is aimed at academic staff improvements, there are milestones proposed by the FIP, which are assessed for pharmacy schools regularly, and the assessors include pharmacy students. So it's an all-inclusive thing that is happening. The improvement of academic capacity through peer-to-peer sharing of best practices is another approach. Last year, during an FIP UNESCO UNITWIN Center for Excellence in Africa face-to-face meeting held in June in Kenya, participants presented reports on the key highlights of the pharmacy education survey for the various institutions that they represent. And presenters from the different institutions across Sub-Saharan Africa shared challenges as well as best practices at their institutions. The interactions and discussions were centered on curriculum review, among other pertinent issues. Participants therefore had the opportunity to learn firsthand what pertains in other pharmacy schools in other countries. The FIP UNESCO UNITWIN Center for Excellence in Africa platform has been an excellent source of improving academic capacity, as participants would be able to implement the best practices learned from other institutions at their own schools. Furthermore, UNITWIN colleagues at the face-to-face meeting also learned about postgraduate courses offered in other institutions, which they could access to recommend for their undergraduate students to help to improve the workforce when it comes to pharmacy education. So these are just key points from the report, and I encourage everyone to download and then peruse the report, the full version of it. Thank you so much.
Thank you, Mariam, for that report. This obviously is a very critical area for pharmacy education in Africa. I might interject here that the three areas that we're talking about here of academic capacity and next needs-based education and then advocacy were the 3 top priorities for the Center for Excellence members at a meeting several years ago of the many different areas that they needed to address. But these came out as their top 3 areas to focus on, and been doing a great job doing that. So thank you, Miriam. Excellent remarks there. So our next speaker is Derek Munkambwe from Zambia. Derek is a pharmacist and lecturer in the Department of Pharmacy in the School of Health Sciences at the University of Zambia. He holds a PhD in pharmacy and has a strong interest and background in pharmacy education. He currently serves as the lead for the Center for Excellence Needs-Based Education Initiative. So welcome, Derek.
Thank you so much, Rob. Welcome everyone to the Sub-Saharan Africa report launch. I'll briefly talk about the needs-based education in the context of Africa. There are a lot of definitions that can be provided to needs-based education, but in general, it refers to the education system that meets the current as well as the future needs of a given profession, a community, or rather a country. So the basic question is, do we have in Africa an education system that meets the unique pharmacy education needs for each and every country on the continent? Probably people will be quick to say, many of them to say, no, we don't have an education system actually that meets the needs of all the countries in Africa. FIP recognizes that there is no one competence education framework that can adequately address all the needs in African countries. And therefore, there is a need to tailor the needs to the health systems that are in Africa. Currently, in terms of workforce development, and in terms of production of pharmaceutical workforce, in most African countries, the students go through the Bachelor of Pharmacy degree, while in developed countries, such as the United Kingdom or the United States, they have adopted other modes of training. For instance, in the United States, there's a Doctor of Pharmacy degree, which is a PharmD, while in the UK, there is Master of Pharmacy degree. All this was done to tailor the training to the needs of the country. But in Africa, this seems to be actually lacking. So a B Farm here is followed by so many other countries, and there are a few countries now that are coming on board that are adopting the Farm D, for instance, the Doctor of Pharmacy training in Africa. Examples can be given in countries like Nigeria and South Africa. So for instance, there's need to develop the needs-based education in Africa. And this is actually inspired by the varying pharmacy educational needs in these individual countries on the continent. There was a survey that was conducted by the FIP-UNESCO UNITWIN Center for Excellence in Africa that revealed that each country in Africa actually needs the needs-based education. They found out that in Uganda and Nigeria, for instance, it was the substandard and counterfeit drugs that were actually major issues in those two countries. And so they needed to adjust the curricula so that it can meet some of the needs of those particular communities on the continent of Africa. Also, some other countries in Africa, it's been the issue of antimicrobial resistance, for instance. So it's a question of how is antimicrobial resistance being tackled, because this is a need in some of these countries, which need to be actually addressed. So there have been discussions or conversations regarding introduction of antimicrobial stewardship programs, for instance, or incorporating antimicrobial stewardship content into the curricula of African schools. Therefore, there is need actually in Africa to have a needs-based education system that is tailored to meet the unique needs that we face on the continent. So in conclusion, what I would say is that there's need to have the holistic transformational approach that will include academic capacity building, building of new policies in Africa, strengthening regulatory institutions through government and other stakeholders. And I think that if we move that way, we'll be able to address some of these gaps that we have seen that relate to the needs-based education in Africa. Thank you so much, Ralph.
Thank you, Derek. You know, needs-based education is a short title, but a huge amount of work. And so we thank you very much for taking the lead on that for the center. And as you've illustrated quite well, there is more work. We've made progress and of course, more work to be done. Our next speaker is on advocacy. It's Stanley Ndigwe, who is the chairman and senior lecturer in the Department of Pharmaceutical Chemistry at the University of Nairobi in Kenya. And he serves as our lead for advocacy for the Center for Excellence in Africa. So welcome, Stanley.
Thank you very much, Love, for the introduction. Welcome everybody to this presentation. Mine is quite fast, and it has to do with the advocacy in Africa when it comes to pharmacy as an education. How do we get the support of the public or the government as we try to change and make pharmacy more relevant? I would like to mention 3 countries: Kenya, Ghana, and also Zambia. What is happening there and what you can do differently. In Kenya, for example, we have got 3 groups, almost 5 groups that are dealing with the advocacy. We have a trade union which is called Kenya Medical Practitioners and Dentists Union, which deals with issues of remuneration of pharmacists and doctors. We also have pharmacy academia, whereby lecturers are working together to try to get acceptability of the new training in the PharmD from the BPharm, which we have been having for many, many years. And also we have the Pharmaceutical State of Kenya, which is a body for the pharmacists. And it takes care of the welfare of us as a profession. And finally, Kenya Pharmaceutical Association, which is a group which represents people with diplomas in the pharmacy. We have seen the way they have worked together, and we have been able to move from one success to another, and pharmacy is being taken more seriously. Then, if you look at the challenges, we have been having a lot of challenges in Kenya, for example, in terms of quality provision of medicine. Those are the same problems we find in Sub-Saharan Africa all over. But the challenges never end. Before I mention about the other countries, at the moment, we are having issues whereby pharmacists have been singled out in the University of Nairobi, and administration have said pharmacists are not doctors, and so there have been some allowances not being paid. So in other words, these problems can keep on happening and happening, and you must be on the lookout all the time to advocate for better terms of service, better recognition as a profession. If I look at the situation in the University of Zambia, they have been going through some changes whereby they have advocated for changing their curriculum, introducing new things in their training, for example, supply chain, veterinary pharmacy, And it is projected after the last engagement pharmacy universities held with stakeholders, we are going to start graduating better pharmacists as from 2021, who are going to play a bigger role in healthcare. Finally, if I mention our brothers in Ghana, we have also seen they are actually ahead of us, like in Kenya, where by them they already have PharmD graduates. And we met them last year. I think we had a conference in Mombasa, and we shared and we learned a lot from what Ghana is doing. And due to advocacy, we have been able to move a step ahead. And to note one thing, that the advocacy has helped the PharmD graduates to be recognized. Before, they were not being recognized as they should have been, and in terms of pay. But I think because of the advocacy, they were able to make the government recognize that they are starting at a higher level. And also, something very important, which we are trying to copy from Ghana, that today Ghana recognizes fellowships in pharmacy as terminal degrees. This is something which we can learn from each other, but we keep on pushing, advocating for better recognition for us, and that way we are going to put pharmacy at the center of provision of quality pharmaceutical care. Thanks, and I challenge you to look at the report, and you'll see the various reports we have talked about in the, from the various countries in Africa. And we keep on sharing and try to grow advocacy. Thank you so much for joining. Asante.
Thank you, Stanley. Yes, thank you, Stanley, for that those excellent comments on advocacy. And I would like to stress to everyone on this call, everyone in pharmacy, that advocacy is such an important role for all of us to advance. It helps to create the enabling environment for the work that we want to accomplish in terms of advancing pharmacy education and advancing pharmacy practice. And it's something we all need to pay close attention to and to work on literally year in and year out to bring pharmacy up to the level that we all desire it to be, and it needs to be in order to improve the health of all of our communities. So really critically important area for all of us, and certainly in Africa. So thank you very much for that report, Stanley. We're now going to move on to country profiles and best practices. Nilhan will start us off. I don't think she needs any introduction at this point. Nilhan?
Thank you, Ralph. So we will present you, we have been receiving a lot of questions about the curriculum review processes and the needs assessment education strategies. So at the FIP-UNESCO UNITWIN Center for Excellence, we have used FIP's tools, resources that was built over a decade to develop a needs assessment framework. And then we develop country profiles for that. We believe that this is one of the most important part that will guide other countries to do the same in order to identify needs and priorities in this country. So I'll start with describing you how we have developed the needs assessment framework, and then I'll hand over to my colleague Ellison to present the country profiles, and also will present you a pilot country profile for that. So the FIP UNITWIN Needs Assessment Framework builds on FIP's pharmacy education resources and tools developed over the past decade. Member institutions from FIP-UNESCO UNITWIN Center for Excellence in Africa performed an education standard assessment using FIP's Nanjing statements. And then curriculum assessment and mapping have been done through FIP's Global Competency Framework, looking at the competencies and how they match the education outcomes. Then we used FIP's Pharmaceutical Workforce Development Goals, which facilitated the workforce needs assessment, and a comprehensive scope of practice questionnaire was developed using FIP's FIP Global Pharmacy Education Survey and various resources such as WHO's National Health Workforce Accounts. And then we analyzed the state of pharmacy practice and education in each country. At this report, we provide comprehensive pharmacy education country profiles from Ghana, Kenya, Malawi, Namibia, Nigeria, Uganda, and Zambia, who were member institutions of our network. And we also envision that this should be scaled up to all countries across Africa. Now I'll hand over to my colleague Alison to present country profiles and best practices. And we invite you to also support us with scaling up this to your country. So I'll now hand over to Ralph first.
Okay. So Alison Ekweri Williams is our next speaker from Nigeria. She is a pharmacist trained in Nigeria. She is the immediate past chairperson of Pharmacy Education for the International Pharmaceutical Students Federation, and also served as the Pharmacy Education Advocacy Coordinator. And she currently serves as the project coordinator for our FIP-UNESCO Center for Excellence in Africa. And as I've already mentioned, and thanking her for the incredibly great work that she has done on our behalf for the entire program, as well as this report. So Alison, over to you.
Yeah, thank you, Ralph, and greetings from Nigeria. So just going straight to the country profile. The country profile of this report is a snapshot showing the state of pharmacy education in the 7 UNITWIN member institutions using certain indicators. So it begins with, as you can see on the slide, a brief article on the education trends, innovation, transformation, and drivers of curriculum change in each country. Then the second segment of this profile highlights the general information about pharmacy education and practice, including the courses that are offered, the qualifications, the admission requirements, and the credit recognition of prior learning. The next segment of the country profile basically shows a concise description of the curriculum focus area, including the core country curriculum, the delivery of the curriculum, experiential learning, accreditation, and quality assurance of learning. And this segment also has information on the institutional academic capacity and infrastructure, which is very necessary to deliver pharmacy curriculum. And finally, the country profile shows specific information on the pharmacist competency framework and also the results of the FIP UNITWIN needs assessment, which my dear colleague Neilhan has already described. So I would invite everyone to go through the report, go through the different country profiles, and learn the different indicators and factors affecting pharmacy education in the country. Next slide, please. I'm going to share here highlights from Kenya's profile. And we have that in Kenya, the education trends had shown over time that there had been a shift in focus of pharmacy education from a heavily science-oriented program to a more clinical pharmacy-oriented program, which Khalid has also spoken about and has shown in the report. And we also have opportunities for specialization in industrial pharmacy and other specialty. And this shift was due to an observed deficiency in clinical skills of graduates. There has also been marked innovation in pharmacy education systems of Kenya via alignment with the government's universal health coverage policy, especially primary healthcare approach, and the sees this opportunity to empower and educate pharmacists and students. It may also interest you to know that the transformation in education has been in relation to experiential learning, and this has been done through the FIP project in partnership with University of Nottingham in the UK and other 5 public schools in Kenya. The major drivers of curriculum change, as based on what I've shared so far, you may see is the existing practice setting, as most of the graduates worked in hospital and community pharmacies. So there was a need to improve their clinical skills to ensure that pharmacists adequately meet the needs of the public. Next slide, please. Yeah. sharing highlights of the FIP UNITWIN needs assessment, which Neilhan already described. We have that the education standard assessment showed that the University of Nairobi Pharmacy Education Standard in Kenya have strong links with the clusters of quality assurance, continuous professional development, shared global vision, and recruitment of students, all of which are the FIP Nanjing statements clusters, which is the global standard and vision for pharmacy education. However, there were few gaps that needs to be filled to improve this education standard, and these were majorly identified in the professional skills mix, the foundation training, experiential education, and resources and academic staff. Then for the curriculum assessment, we have that the mapping of the curriculum showed that mostly the pharmaceutical science and basic science courses covered about 79% of the total credit. And having mapped the curriculum and the educational outcomes against the FIP Global Competency Framework, which supports educational development of pharmacy practitioners, Kenya showed that all these competencies in this framework were of highest priorities to them. However, the learning
I think we don't hear Ellison.
Yeah, I think we lost her.
Ellison, could you try to mute and unmute yourself again?
You want to hear me now?
Yes, now
Yes.
working. Go ahead.
Okay, thank you. So speaking on the workforce needs assessment, this was mapped against the 13 pharmaceutical workforce development goals, and it showed that Kenya has strong links and local policies relating to the quality assurance cluster and the foundation training of pharmacists. So again, I will invite you to go through the report and you would see the country profiles of all the UNITWIN partners. You will get to learn and get enough information for yourself and practice. Next slide. Okay, so in UNITWIN, we have that sharing best practices through twinning of partner institutions is one of the approaches that we achieve our goals. And this report highlights some of these best practices that have been achieved from our partner countries over the years. We have, for example, in Kenya, the Kenya-Nottingham partnership, which I already mentioned, helps to improve experiential learning in Kenya. Then we have developing a curriculum on substandard and falsified medicines through partnership in Uganda, which my colleague Stanley has already spoken about. Then we have innovative ways of developing new pharmacy programs from scratch to excellence in Namibia. Then also an infrastructural project, which is the Lab Box Malawi project in Malawi. Then this really innovative research project on needs-based education strategy for pharmacy workforce development in Nigeria. So thank you very much for listening, and I'll be happy to take any questions you have from this part of the report. Feel free to go through this section, and I'll give the floor back to Neilhan. Thank you.
Okay, well, Allison, thank you for that great overview of this part of the report. I think this is a particularly enlightening part of the report in terms of how this Center for Excellence has utilized these FIP resources that Allison talked about, the Nanjing statements, the workforce development goals, and competency frameworks to map their curricula and see where their gaps are and where they need to go and how they've begun to fill in those gaps. So I think it's a particularly interesting part of the report that is quite enlightening. So thank you to all of our speakers. It's great to see you, even if remotely, and can't wait until we can get together again in person to continue our work together. We're going to now move on to the special focus areas that I mentioned earlier on quality assurance, youth and students, the COVID pandemic, and FIP-WISE program. And I'm going to ask the speakers to please be certain to not go over your time. We don't, because we want to keep our entire program online and time-wise, and have time for the panel discussion that's coming up shortly. So we'll move on now to quality assurance and Nilhan.
Thank you, Ralph. Quality assurance has been instrumental to this report, quality assurance of pharmacy education. That's an area that we have focused on different chapters of the report throughout the report itself. In the country profiles, we have provided a snapshot of the quality assurance and accreditation status of each country. But in this chapter, again, our colleagues from Workforce Development Hub, they have provided a specific focus on each country and their quality assurance and accreditation processes in their countries. And findings of this chapter supports the implementation of new teaching methods, innovative training models to increase the quality assurance in pharmacy education. And again, for a quality education across Africa, continuous curriculum review and more academic pharmacy staff are needed. So these were the two main findings of the quality assurance chapter. Thank you very much.
Okay, thank you. Thank you, Nilhan. Our next one, and I think is particularly important, is a focus on youth and students, and Anikan Ekpenyang from Nigeria will be presenting this part. He's a pharmacist in Nigeria, currently completing a postgraduate degree in global health policy from the University of Edinburgh in Scotland. And he serves as the director of the Global Health Focus in the African region, where he supports the building of a network of young healthcare professionals interested in global health. Anikan, over to you.
Thank you so much, Ralph. I'll be presenting about what young pharmacists and pharmacy students who are the future of the profession are doing to promote pharmacy education in Africa. Young pharmacists in Africa have been at the forefront of advocacy for the development and implementation of continuous professional development activities in the continent. For instance, the Cameroon Young Pharmacists Group have collaborated with the National Order of Pharmacists to develop CPD activities. Nigerian young pharmacists have been engaging in activities to promote the lifelong learning of its members. Annual conferences are held where cutting-edge knowledge, including pharmacy education, are discussed. Some young pharmacists in the country have been sponsored to attend FIP conferences to promote their professional development. Other countries such as South Africa, Zimbabwe, Sierra Leone, Kenya, and Rwanda have recently put in place the YPG groups, and they've also put in place activities to promote the continuous education of young pharmacists. Also, pharmacy students have vibrant advocates of pharmacy education in the region. Pharmacy Student Association, under the auspices of the International Pharmaceutical Students Federation, the African Regional Office of the IPSF, have organized regional symposia, workshops, and trainings to specifically promote pharmacy education to its members. For instance, in 2018, the IPSF African Regional Office organized a conference in Lagos where students were introduced to the FIP Nanjing Statement, the FIP Global Vision for Pharmacy Education, and the FIP Pharmaceutical Workforce Development Goals. The conference has led to a country-level awareness campaign organized by students to promote the FIP Nanjing Statements. Apart from advocacy, pharmacy students in the region are also committed to research and evidence generation in transforming pharmacy education. A focus group discussion conducted last year among pharmacy students in 9 countries in Africa to determine the education needs of pharmacy students in the region revealed that students would appreciate an opportunity for increased experiential learning content in the curriculum, which at the moment is perceived to be inadequate. There's also a renewed call for an increase in mentorship for members of faculty. Also, pharmacy students will love greater support for participation in national and international pharmacy events. Hence, it is essential that pharmacy students and young pharmacists are continually supported to keep promoting pharmacy education and secure the future of the profession. There are other initiatives that pharmacy students have done, and to be wise if we can take time and go through the report. Thank you.
Yeah, thank you very much for those remarks, Anakin. I do think we need to always keep in mind the future of pharmacy, and that is our students and our young pharmacists and their perspectives. So thank you for providing that for us. The next two speakers on COVID, pandemic and FIP-WISE don't need an introduction, Allison and Miriam. So I'm going to ask you two to make your remarks now. Don't need any introduction from me.
Thank
All
you,
yours,
Ralph.
Allison. Mm-hmm.
Okay, so just sharing the special focus area on COVID-19 pandemic and how it affected pharmacy education in the region. We have that it's established that the closure of academic institutions had occurred due to the pandemic, and this was a global problem. And a lot of institutions across the globe adapted to remote learning strategies to continue their education and learning. This chapter of the report highlights how this pandemic further exposed the inequities in pharmacy education across the UNITWIN partners in Sub-Saharan Africa, as evident in the context of continuation of education and delivery of education. So while some partner institutions were able to continue training remotely, other institutions were not able to achieve this. And of course, this would result in lack phase of graduation into the pharmaceutical workforce at a very critical time when more pharmacists are needed to deliver in the healthcare system. So adapting to remote learning initiatives in remote limited settings, like in the Sub-Saharan Africa now, has been quite challenging. However, there has been deliberate provision of support to students and faculty members during this time. Despite this, FIP commits to provide support by providing avenue for academic knowledge, resource experience, and good practice sharing to ensure delivery of the best possible needs-based education, irrespective of the pandemic or what is happening across the globe. Thank you very much.
Hello.
All yours, Miriam.
Thank you very much.
Mm-hmm.
So FIP-WISE provides women in pharmaceutical science and pharmacy education with a support system of other women whom they can relate to and who can help them to overcome any challenge through diverse ways. Together with FIP-WISE, women can achieve both their individual and collective goals. So we also encourage all women in pharmaceutical science and pharmacy education to visit our website and join FIP-WISE. Now, when it comes to promotion of their well-being and providing a support system, there are a number of good practices from across Sub-Saharan Africa. I would like to talk about the Lady Pharmacists Association of Ghana, LAPAG, which champions collaborations and mentorship for women pharmacists. I also like to commend our institutions that provide institutional support in terms of improvement of teaching and then knowledge generation and communication of knowledge. One key area which the institution, such as the universities, have helped women improve is promoting improvement of participation of women when it comes to leadership and administrative positions at both the institutional and national levels. And there is an example that is quite dear to our hearts, a case in point. In 2016, the Faculty of Pharmacy and Pharmaceutical Sciences of KNUST, which is my university, elected its first female dean of the faculty in the person of Professor Rita Akosua-Dixon, who is also a UNITWIN colleague. And she went on to become the Pro-Vice Chancellor and currently the Vice Chancellor of KNUST, which has been in existence for about 70 years. So it means that gradually women, we are getting there. Of course, there are challenges faced by pharmacy educators, both men and women, but these challenges affect women more because for most women in Sub-Saharan Africa, we are the principal providers of care for children, for the elderly, for physically challenged, and indeed whole families. And so when there's limited time available for research and community engagement, it really affects career advancement. And so I'll encourage all of us to download the report and then read the full version of the FIP-wise contribution. Thank you. Over to you, Ralph.
Okay, thank you, Miriam. So that concludes the overview of the report and the various areas in that report. And the report ends in our final chapter with a way forward and recommendations for how to build on the accomplishments, the challenges, and the continued actions that we need to take going forward. So the report provides us with the accomplishments of academic pharmacy in Sub-Saharan Africa, the challenges that lie ahead, and the actions that we still need to take to continue to advance pharmacy education. The executive summary of the report captures a number of these elements on areas that of continued work for the Center for Excellence. Those would be, of course, on needs-based education, academic capacity, and advocacy. And it also addresses other needs, such as adequate investment in pharmacy education to address some specific areas, such as interprofessional education and practice training, postgraduate specialist development, public health skills, lifelong learning, experiential learning, development of academic staff, and infrastructure. And of course, the Center for Excellence will continue on all of these efforts in the months and the years ahead. But as we closed the report in the final chapter, we focused on 4 broad areas to build on the accomplishments that we have to date and help to provide the center for use as a model for expanding the UNITWIN program to other regions of the world. So those 4 areas are inequities, partnerships, African Association of Pharmacy Schools, and expanding UNITWIN to other regions. So I'll make a few remarks on each one of those. Inequities in the system focus on 2 main factors: economic inequities and gender inequities, as we just heard from Miriam, that really are impediments, if you will, to the advances that we are all striving to make. Progress on gender inequities is beginning to occur, and through the FIP-WISE program and the things that Miriam talked about, progress is beginning to be made. However, the COVID pandemic really has put up another barrier to this progress, and actually has highlighted these inequities, both the economic side and the gender side within academia, for students as well as faculty. So we have to continue to really look into the inequities, the causes for these, recognize them, and embark on purposeful efforts to right these inequities so that we can make the progress that we want to. So this is a major focus of the initial UNESCO UNITWIN program, and it continues to be an area that we all need to be paying more attention to and working toward reducing and eventually eliminating the various sources of inequities in the academic system. Partnerships is the second one. UNITWIN is about twinning universities to learn from each other, to learn together, and to make progress together. And the center has made significant inroads into these collaborations and partnerships, as you've heard. And FIP serves as a platform to build such partnerships beyond those that exist today, with partners both internal and external to Africa, for the purpose of continuing the efforts to transform pharmacy education. And this is part of a new FIP partnership program. One other aspect of partnership and collaboration that we should not overlook, and we have addressed in this report and you just heard about, and that is the partnership that we need to have with our young pharmacists and our current pharmacy students. And as we have heard, they have the largest stake in their futures, and we need to be listening to them, working with them, and act in their best interests as we look forward to transforming our curriculum and providing early career development programs for young pharmacists. So this is an area where I think a number of people on this who have joined us in this event will be able to participate as we roll out these. We're going to have a partnership pilot program for the UNITWIN program in Africa coming up shortly, and then hopefully extended once that pilot is over, extended beyond to others. So we can all look forward to that partnership program. Now, the next one is the African Association for Pharmacy Schools. And this idea for this particular recommendation began over a dinner conversation at our annual center meeting in Namibia a few years back. And this story highlights the creative discussions that occurred during these in-person meetings versus our virtual meetings that we're all getting used to and maybe overburdened with. But that we hopefully will be back to these in-person meetings and generating these networking and creative ideas as we move forward once we get this pandemic under control. So why this particular recommendation for an association? Well, many countries and regions of the world have these associations where networks are formed, partnerships and collaborations are ignited, and innovations bloom and progress is made much faster in a synergistic fashion as opposed to a go-it-alone strategy. Examples include a number of these associations that I have had the good fortune of participating with over the years. The American Association for Colleges of Pharmacy in the US, a similar association in Canada, the Asian Association of Schools of Pharmacy, obviously in Asia, the India Association of Colleges of Pharmacy, and the European Association of Faculties of Pharmacy, and others that I have not yet participated in, but hope to one day, for example, in Latin America and Australia. At our last in-person center conference in Mombasa, Kenya in 2019, our members voted unanimously to recommend and pursue this association of African pharmacy schools. And we see this as a sustainable future for progress in the African pharmacy education transformation program. So we will be working on this. I'll have an announcement for it shortly after at the end of the program here. And the last one is expanding UNITWIN to other regions. So this is how we can use the accomplishments and the model that's been developed in the African Center for Excellence to expand the UNITWIN program to other regions of the world that meets its original global mandate. So the lessons learned here, the work done here can have far-reaching effects on transforming pharmacy education to all corners of the world that address not only the FIP development goals, but the UN sustainable goals, meet WHO's health challenges for the next decade, to improve primary and specialty healthcare as they relate to medicine's expertise, and to support the achievement of universal health coverage. Pharmacy has an incredible role to play here, and it all begins, as Dominique said, with education and the right education. So that brings an end to our report presentations, and next we're going to hear from you. So I think we need the next slide there. So we have a very quick poll for everyone in the audience. Which way forward area do you think should be a priority for your country? And of course, we have the areas shown here. the ones we just talked about, the addressing inequities, establishing partnerships in Africa and beyond, participating in this proposed African Association for Pharmacy Schools, or participating in the expansion of UNITWIN to advance pharmacy education to other regions. So we'll leave this poll up here for about 30 seconds for you to respond to one area that you think ought to be a priority in your country. Or maybe just what you want to be the priority. Okay. Well, remarkably, actually, I really like this. I think it's absolutely great that we just didn't pick one for everybody, but we have a pretty even distribution of priorities, which actually I think is absolutely great, because these are the areas that we want to focus on. And so all of you did a great job in responding to this poll. Really appreciate it. And we'll be moving forward on all of these. And in doing so, we're going to be involving and some of you who are in this audience, as you'll see in a short bit. So thank you very much for participating in that poll. And I think we're going to now address some of the questions that we have. Some came up in the chat room. They may have been answered already, some in the Q&A box. So Nilhan, Allison, turn it over to you for what some of those questions may be. Are they directed to certain individuals, or are they general for us to respond to?
Thank you, Ralph. Also very interesting results of the poll indeed. So I think the panel discussion will be much more interesting. Thanks everyone for their questions. I'm also amazed by the number of participants. We are 274 by now, and they are still with us, so that's great. We also received a lot of questions, so I'll try to summarize all of them and respond some of them because they already have responses, and I'll also then forward some of the questions to you. So we have some of the questions we're asking some items that were already addressed in the report. So I just wanted to start with them first. So the question was a very broad question about what are the key needs of pharmacy profession across Africa and what needs to be done to achieve universal health coverage. So in our report, in the first and second chapter, we have tackled these questions broadly. So you may refer to our report. We will distribute the report shortly virtually. So please bear with us while we are discussing the Q&A. And there was an interesting and a question that we were also aware, collaboration with Francophone countries and also Portuguese-speaking countries. So this is also one of our way forward area that we would like to set up the African, we are advocating for African Pharmacy School Association. So this is that way forward area is an answer to that. And there were questions about continuous assessment of needs and skills across Africa. So we also brought some focus on these areas in the report chapters. So you may refer to that. And also there were questions about skills and education around the increasing need of pharmaceutical industry and manufacturing across Africa. Again, in chapter 2, especially with our colleagues from South Africa, they provided an extensive overview of how they have done this in their country. And we were asked whether FIP is able to provide infrastructure support. And for example, our lab box project, that was a collaboration project that provided some infrastructure support. So this network, this coalitions is the place where it's an incubation of different infrastructural needs. So please feel free to follow the FIP-UNESCO UNITWIN network to explore what kind of partnerships can be made around that. And there were questions about scholarships. So these all have been addressed in the report, particularly in chapter 2. So please feel free to go back to our report for these specific areas. I'll come to the questions. So I'll tackle two of the questions which I picked. So we would love to address all of them. Maybe we'll do another webinar to address these questions. But we will, as we move to our panel, we'll try to keep it with two questions. So the first question was about mentorship and academic capacity building. So in our report, one of our main finding was focusing on improving academic capacity. And our participants were asking more from our colleagues about what kind of mentorship programs they have developed to their academic staff, what kind of other activities they have done in terms of academic capacity building, and of course, examples from FIP-UNESCO UNITWIN Center for Excellence in Africa. So the question was not to a specific speaker, so I'll pass the question to you, Ralph, for you to decide on whom should respond to that.
So I think this whole idea of mentorship programs is really very important, but this really goes to the heart of the UniTwin program of university twinning, and here we're talking not just about the leadership of the schools, but faculty to faculty partnering and twinning and working together, and part of that could be easily developed into a mentorship program. So it's all part of really what the UniTwin program is about. And that really comes down to once all of these connections are made, it's up to people who can find each other in their particular areas of interest to learn more and accomplish more together with a mentor-mentee relationship. So you know, some of these exist already within this program, but in others in various parts of the world as well. And particularly now, you know, when we're all getting used to remote education and remote meetings and conferences, these kind of mentor-mentee relationships can easily be established in the remote world, virtual world. So this is, again, an integral part of the UniTwin program. And as we bring these schools together that are part of the center now, those relationships can form. As we expand out to other countries in Africa or in the around the world, and this is obviously going to take time, we will have the system set up where these things can happen naturally. So Nilhan alluded to the African Association of Pharmacy Schools. This is meant to involve all the countries and all the schools in the entire continent of Africa. And this is where, again, from my own experience and that of many others in these other associations that I mentioned, this is where people get together. You stand at a poster, you talk to somebody, and all of a sudden a relationship starts, a partnership starts, a mentor-mentee relationship starts. So setting up an environment that's really an enabling environment for these things to happen is where our focus is. And then those relationships begin to happen naturally once we have those structural and organizational systems set up. So I think that hopefully that answers the question.
Should I move to the other question, Ralph? Okay.
Yes.
So we also received a question about the lack of specialization and also lack of opportunities to pursue postgraduate studies. So we have colleagues among us who have had good best practices and some processes in their countries on offering postgraduate studies in a systematical way. So perhaps they can share their experiences with us to encourage other colleagues in the other countries. So that was one of our questions about opportunities on postgraduate studies. Ralph, would you like to direct the question to one of our colleagues or?
Well, I don't know. One of our speakers, is there anyone who would like to respond to that about opportunities that you have within your program?
Yes, love.
Okay, Stanley.
Stanley Dunga from University of Nairobi. We are actually the leading school of pharmacy in East Africa with the postgraduate courses. We have been trying to develop every year like a new course for masters. At the moment, we have like 6. And we get students from Uganda, Tanzania, Rwanda, and other places. You would be like you to welcome you to look at our website, School of Pharmacy, University of Nairobi. And we're also trying to engage lecturers from Africa as external examiners. We have people from Nigeria, Ghana, Tanzania, and I think there's a way for us to grow. Anybody thinking about postgraduate training and it can be offered in Africa is going to have the experiences we have, and we share and learn from each other. That's what I would say to that question. Thanks, love.
Okay, thank you, Stanley.
Yes, Ralph, I'd like to make a comment there.
Okay, Mahama.
Yes.
And then we'll go to Mariam.
Yes, I think about postgraduate training. Most of our students, over 90%, will not go into the traditional academic field. But we should still provide these people with training. Most people are stuck just after the first degree. But for their professional development, the FIP itself has started something which is good. And we have it here, postgraduate training for advanced practice, so that we are training people as specialists in the various areas of practice. But beyond that, it's not just the training. We've talked about building advocacy skills. The employer must recognize this. So that has to go with the training. I think if we focus on this area of developing the practitioners community and in hospital, that is more likely to meet the needs of most of our people. And also another area that we've forgotten is in production. COVID has shown that we need to rely on ourselves when it comes to drug production. And so these are areas that I think we should talk about.
Yeah, thank you, Mahama, for those comments, because this idea of pharmaceutical industry within each country is really beginning to catch on at the government level as well as within the pharmacy world. So Mariam, I'm sorry to interrupt, but you had a comment.
Thank you very much, Ralph. So to add to what Prof. Muhammad Wedra said, when it comes to now currently, most pharmacy schools in Sub-Saharan Africa have moved from the B Pharm to the PharmD program, which involves a lot of advanced pharmacy practice experience. And so most of the first degree holders in the training centers, in the hospitals, in the community pharmacies have opportunities for postgraduate training. So in Ghana, we have the Ghana College of Pharmacists, and then for West Africa, we have the West Africa College of Pharmacists, which can train pharmacists who will be preceptors to the students who are being trained as undergraduates. And so this is also a way of helping to build the academic capacity, so that when it comes to the advanced pharmacy practice experience, we have trained and skilled preceptors with the needed specialization and qualification to help train the pharmacy workforce. Thank you very much.
Thank you, Mariam. So I'm going to introduce one other area that this is not a part of the UNITWIN program per se, but it is another FIP program, and that's called the Pharma Bridge program. So, you know, we all know lifelong learning. You never stop learning. You should never stop learning. The Pharma Bridge program, you can apply to it in an area where you have an interest in learning more and developing more, and then schools also provide to Pharma Bridge where their areas of expertise are, and then there's a link form between the individual looking for development, schools that can provide it, and then that provides an opportunity for individuals to also expand their knowledge and their expertise in specific areas. So that's the Pharma Bridge program. I don't know if Nilhan, if we could put it in the chat room somewhere, or Allison, how to get to the Pharma Bridge program. But my school has participated in it for a number of years, and it's a two-way street. We learn from the folks that come to visit us, and they learn from us. Now, this has been a face-to-face program, obviously suspended during the pandemic, but hopefully we'll get back to it. But I suspect some of this can also be done virtually. So, but we'll have the information for you on that. So that's another area that can also help address this concern. Okay.
Ralph, I guess we can move on to the second part. And I will continue with the virtual dissemination of our report. Finally, it says.
Yes, I think this is an important part here, don't you think, Nilhan?
Yes.
Yeah.
So apologies, we haven't been able to address all questions, but the panel will. And we will be continuing with the virtual dissemination of our report, which has been asked the most as a question.
Yes, right.
So I think just wanted to share FIP is delighted to virtually launch the FIP Pharmacy Education in Sub-Saharan Africa report today. We invite academic leaders, faculty members, educators, students, national pharmacy education, and governments to use this report as a roadmap to advance pharmacy education and the profession across Africa and throughout the world. So we have prepared an interactive repository for you to discover the report and join the conversation on how to address the findings of this report. So in our repository, which I will share its link in a while, you will find messages ready for you to post on your social media accounts on key findings and take part in the conversation. You may watch and share the launch video on your social media, and please use FIP's hashtags, which I will share in a while as well. This event is being recorded, so you may go back and watch and share today's recordings again to revisit the key findings and what our leaders today shared as their messages. And of course, you may download the report and share it across your network. So this link you find here, and you may also scan the QR code today, will take you to our multimedia repository. And again, you'll find all of these resources I shared with you, and you may immediately use these resources, for example, to organize a debate, panel, or a Q&A discussion about the findings of this report in your country. And of course, after this event, we'll share this link with you to the repository, so you'll have a direct access. But feel free to go to the website, explore the repository, and engage in the conversation with us. Use the FIP in Africa, Pharmacy in Africa, and Pharmacy Education hashtags, so we know and we follow your messages. And if you have any questions about the report or today's event, please connect with us from education@fip.org. And we will be again sharing this with you after the event. So I'm moving on to our panel now. Thank you.
Okay. So we made it to part 2. And this is our panel discussion to address the way forward areas and recommendations going forward. So here is our distinguished panel. It starts with Catherine Duggan on the left, who is our CEO of FIP, George Openjuru, who is the UNESCO Chair and Professor of Education and Vice Chancellor at Gulu University in Uganda, Prosper Haig, who is the President of the African Pharmaceutical Forum, and he's from Cameroon. Mahama, who we just heard from just a moment ago, is one of the co-founders of the UNITWIN Center for Excellence program in Africa. He is from Ghana. And Jennifer Naomi, who is the acting team leader for the Health Workforce Unit and the Universal Health Coverage Life Course Cluster as part of WHO Afro, and she is from the Congo. So I'm not going to take up any more of their time, but we're going to start with one question to Catherine, and you each get 5 minutes, If you can do it less, that would be great. So we could hopefully stay on time and have some time for questions and answers after your presentations. Catherine, how do you see FIP's supportive role in the future of the Center in Africa and the proposed African Association of Pharmacy Schools, as well as the expansion of UNITWIN to other regions of the world? Can you do that in like 3 minutes?
I can indeed, Ralph.
Okay, thank you.
It might be super speedy, but I can try. Yeah,
good.
Thanks so much, Ralph. I just wanted to say a couple of words by way of my own personal thanks, not only to you and Nilhan and to Dominique and all of our colleagues who have authored the report on the line today. But from my perspective as CEO, alongside the words Dominique made at the beginning, FIP always builds on its strengths year by year, presidency by presidency, and it's important for us to recognise those colleagues who laid the path we tread today. So a few mini thanks from me as CEO. Thanks to the then President Kamal Midha and Ian Bates for their vision and collaborative work in setting up the original partnership through the UCL FIP Collaborating Center, from which this work started and has flourished to today, decade on. Indeed, CAM published the famed 2020 vision, which established education as an arm of our federation. And here we are in 2020, this seismic strange year, taking this work forward to the next decade. And many of you will know that the original bid also made mention of the need for a particular focus on women in science and education. And I'm pleased to see we've now established that through FIP-WISE as part of our equity work since 2019. But we've always had great leadership from women in science and education. And I must say a special thank you to Jennifer Marriott for her leadership in the middle days of UNITWIN and her championship of the great work, and to Claire Anderson for linking the twinning elements of science and education and collaboration through the SPHERE programme, which was completed this year. Back, of course, to today, because it's all about pharmacy education in Africa, with all the panelists, particularly from the African Pharmacy Forum, WHO Afro, UNESCO Africa, and the UNITWIN Center for Excellence. We really want our colleagues on the ground to feel ownership of the findings, as you will be the regional champions to address this in the future, collaboration with FIP. And as Dominique and Ralph have clearly said, clearly articulated, that a global vision is only worthy if it is operated through different regions and then through those regions, in those regions, through those nations. So Africa is really leading the way on this work, and FIP is super excited about this in many elements. The programme addresses front and centre the equity and equality programme under the FIP Development Goal number 10 in the context of addressing inequities in pharmacy education, as has been said very eloquently. And we know that in each of our goals, and I urge you to have a look at those development goals, we have a workforce element. So we need clear strategies for addressing equity and inequities and inequalities in our pharmaceutical workforce development and career progression. The education element, we need clear strategies for equity, diversity in pharmaceutical education delivery, but also we see this in the questions, Nilhan, the pharmaceutical sciences issues here. And that brings me to science, which is equity in global capacity of pharmaceutical sciences, training, research, infrastructure, development, manufacturing capabilities, and evidence-based regulatory oversight. Thank you, Ralph.
Thank you, Catherine. So I've asked the panelists to address one or two of the areas that you see across the bottom of that slide on our way forward, or if they had some other area that they think we really ought to be paying attention to. That's, again, one of these overriding umbrella issues. And so we'll start with George Openjuru from Uganda.
It says good evening in Uganda here. It's unfortunate that my power went off. I had to go back to connect, so I've missed a bit of the information. In Uganda, I think, especially at Gulu University, the focus is starting training at a lower level of pharmacy education. The university has 2 institutes and 5 faculties. and we are developing programs in pharmacy, but focusing particularly in PharmD, which you have been talking about, as opposed to graduate training school. But we started all the way from the certificate level training, diploma level training, targeting at commercial pharmacies that are working within towns, so that we can provide professionals and not nurses working in those pharmacies. Because we realized that that was a gap that was not being attended to. So not only supplying hospitals, which include public hospitals and private hospitals, but also pharmaceutical shops, drug shops, including pharmaceutical industries. So we have the resource requirements. We focus on a lot of diversity, not on a lot of diversity in pharmacy training, which includes traditional medicine, natural products pharmacists. We have the clinical pharmacists working in the hospitals. We have the vets for vet drugs, veterinary pharmacists. We have radio programs to train people on issues of use of medicine to avoid issues microbial resistance, infectious disease pharmacies, and including those who, as I said, works in industries. So we are working towards building a pharmaceutical workforce for a stronger health system in Uganda through specializations, attending all categories of health, whether traditionals or modern hospital care training. And then the next slide. Can I go to the next slide? Yes. We have three public universities offering pharmacy in Uganda, including Gulu University, plus one private pharmacy. So the training is not as widespread, and it is not yet highly specialized. Although there are training at PhD level, but that one focuses on pharmacology, there is still a gap, because when we start from diploma, progressing on to the PharmD, we still have nothing at the master's level, going to the PhD level. So there is still need for higher education training of more academics than the skills area. This is, of course, the same with other African countries. So the curriculum offerings or undertaking should provide for all the diversities that I've spoken about. Pharmaceutical industries that are engaged in the productions of drugs, they also need pharmacies. And then those who go out into the community, they also need that. And those are what has happened. I have been taken out of my slides. Yeah. So within this COVID, there has been, that's the last point, a new realization that there is need to pay close attention to COVID. The disruption, of course, is there, but nonetheless, we managed to get the Pharmaceutical Society of Uganda to come and assess our program offering capabilities for training of students in pharmacy within this pandemic time. We hope when the situation normalizes with COVID in it, we will then come up with new innovations of how we can proceed. Thank you very much. Back to Ralph.
Gotta unmute myself. Thank you, George, for those comments. And we look forward to having your new program become part of UNITWIN as we expand out, and hopefully this African Association of Pharmacy Schools. So Prosper, President of the African Pharmaceutical Forum.
Thank you, Ralph.
Over to you. Mm-hmm.
Greetings from Africa, and congratulations and thanks to all your team for the big job done. Thank you. At the level of the APF, we agree with all what have been said in this report. the report is very complete and completed. And there are some few things that I wanted to add on that. I think it's Mohammed who talked about migration. Some lecturers, the staff academia, going from our countries to Europe, to United States, everywhere. This is a loss for us. This has to be taken in consideration, because what I think is that we should now think about utilizing the diaspora, which is out of Africa, to come in the program of UNITWIN, FIP-UNESCO UNITWIN. You people understand what I say, that there are many of us who are living in the United States, in all those great countries, working there, but not for no benefit for us. We have to see now how we can benefit from them, how the diaspora can become a real a country, a state to help the other states of Africa. That is first. I encourage the partnership. I've seen in my visit to Nigeria, to Ghana, mainly in Nigeria, that they have a conference of dean of faculties, at the same time at the PSN conference. They have their meeting, they are sharing their experience, and they are developing their program. This has to be encouraged in other countries and all over Africa. We need also partnership from the other region of FIP, like West Pacific or EMRO. We can partner with them also. The expand of FIP-UNESCO UNITWIN is mandatory, talking about French-speaking countries and Portuguese-speaking countries. We have to do something for them. We have to harmonize the curricula in all the continents. All the continents should come together in the African Association of School Pharmacists. I think we have just only benefit for that. That is what I wanted to say, and to conclude by saying that we cannot move to universal health coverage with a low level of academia, of pharmacy school. We have to go ahead with the workforce development goal, so we will win the fight against all the pandemics. Thank you.
Thank you for those are great comments, Prosper. All issues that we need to work on for certain, and I think we're moving in that direction. But thank you for keeping us focused on those really important issues. I might add, if you don't mind me injecting a couple of comments here, your Conference of Deans or School Leadership, FIP has a program for that, the Global Academic Leaders Program, and I would encourage folks to join that program as an institution, and they have programs throughout the year, doing more obviously in the digital world, and there's a leadership program that'll be starting up next year in 21. And I do think the issue of bringing in the French and Portuguese speaking countries is critically important to UNITWIN. And again, I think this was mentioned earlier. This African Association of Pharmacy Schools your issue there just highlights the importance of this association. And the one that's closest to me that I see for this African Association is the Asian Association of Pharmacy Schools. A huge geographical area, many different languages, many different countries, and they have pulled it off. And I think it's a great model that we can use to establish that association in Africa and bring all of the countries in. And so we will be working toward that. I think it's really very important. So thanks, Prosper. Mohammed, we'll go over to you, one of our founding members of the UNITWIN program. Great to see you.
Thank you very much, Ralph. From the comments that I see in the chat column, everybody is excited about what's happening today. We all are. And now, for me, what is left is how do we sustain the energy, the enthusiasm, so that it doesn't wane. It's very important. I've noticed in the project that we have had a seamless transition of transfer of responsibility to a younger group without us even noticing, which is a very excellent thing, which means that there's a succession plan and this project would live beyond individuals if we manage it well, which is important. For those who are in charge now, you are all leaders in one way, and they've already shown that the appropriate skills they are learning. It's important to have the appropriate skills so that you can grow this thing outside. One of those that has been mentioned is advocacy, which should not be played with, communication and collaboration. We need that so we can build the right networks within each country, in the region, and continentally and beyond. That is very important. In West Africa, for instance, we have the West African Health Organization, WAHO. They need to be aware of this thing. And so we have to get the right skills to bring in other people outside pharmacy to see what we're doing. The group must remain focused. I see that they've got various groups, yes, but do we have an implementation monitoring committee to ensure that we keep to the timelines and the deliverables? But this is another thing we have to do to ensure sustainability and things to show. There is strength in numbers. So I go back again to this idea of having an association of African schools of pharmacy. Extremely important. We need to have it. And the deans in that group can serve as a very powerful advocacy group for pharmacy, even at the highest level, the African Union. It's important. Let's have it. The last one, FIP is not going to continue to fund us forever. How are we going to sustain this thing? Funding is critical. At the point that we're going to ask other people for support, we must have something to show. And that is there. Let's build and consolidate what we have. For instance, joint research projects, joint courses, and run these things. And this is where you can take to anybody to show that, yes, we have got an organization that is doing something good worth supporting. Ralph, I'd like to conclude by just also, you've said it before, by recognizing some of the pioneers in this, because it's been a long and winding road. We have people, but we owe all this to people like Jennifer Marriott, who started it with us, Ian Bates, who has always been there, fantastic, Joanna, Andrea Bruno, I see Diane on the list there. They were all very great partners. At that time, this project looked very fuzzy to many of us, but today we see that it's a reality. And finally, my group that has almost expired. Cyril Yusufo, Richard Adomi, I don't know if he's available. Tim Rennie, very good people, and Tyson Mongo from Zambia. I want to thank you all for this opportunity again. Right, I'm done.
Okay. Absolutely fantastic remarks, Mahama. All important issues, and I really appreciate you bringing those forward to keep our focus on all of those things. And your most appropriate kudos to our former members and leaders of UNITWIN and our founding members. So thank you for doing that. And Jennifer, last word of the panel, all yours.
Thank you very much, and good afternoon, fellow panelists and everyone listening in. Greetings from Brazzaville in the regional office of WHO, which for the benefit of the others constitutes 47 countries of the continent. And thank you for the excellent presentation of the report. We look forward to reading it again in detail. As a way of starting my comments, you recall that we have the global strategy for the health workforce in context of SDGs and universal health coverage. And it has key elements in it in terms of the overall goal that which is trying to ensure availability, accessibility, acceptability, coverage, and quality of the workforce through adequate investments to health systems for effective implementation of what we've been talking about this afternoon. So just to assure you that it's in context. Speaking to the issue of addressing inequities in education, you covered a lot of it, but of interest just to confirm that indeed in the context of universal health coverage, we need more qualified health workers to be available where they are required. So I was happy to hear elements of that. And secondly, I think we need affirmative action for the girl child first as countries to advocate sciences in the country level, because if they're there, then they'll enter into areas of pharmacy and other sciences. For example, also in the field, you may note that in the region, according to our records, only 30% of the pharmacists are females in our region. So I think we can up those figures a bit for gender balancing. I also think that we need also affirmative action in providing financial support for the training of those bright students who come from poor households, so that they also enter the labor market for pharmacy. Also, the issue of gap in technology between Africa and the developed world. We need to look at that and see how that also contributes to inequity of students, especially in rural and hard-to-reach areas who have limited access, compounded by poor connectivity and affordability. The issues of regulatory provision and adaptive technologies can also help in reducing these inequities. And in our database, it's interesting to compare with the report that we have on record 357 pharmacy training programs. And in 2017, we had a record that a little over 3,000 graduates from 31 countries in 2017 of pharmacists. So I think we still have a long way to go indeed to meet that gap. In terms of partnerships, I would like to talk to that, and I think the report covers it well. I think it's very important for expanding the capacity of intakes and graduates in the partnership, especially in the area of pharmacy. And because of the costly nature of the programs, I think partnerships can contribute to direct sponsorship or indirect subsidies for the programs to allow those bright students that I'm talking about who may not otherwise afford it. Partnership also can allow us to have collaborative effort across countries to enable them to have better capacities that allow students, even teachers and lecturers, to exchange in the specialized programs. An example of this where WHO has supported such is the training for procurement regulatory practice, for example, in Burkina Faso, that accepts students from Central and West African countries. The MRA course in South Africa, pharmacovigilance in Kenya, quality control in Nigeria, etc. So I think these are some of the things that partnerships can help to do. And also promoting interprofessional education and collaborative options, skill mix, fit for purpose, which of course include pharmacies. Commenting on the issue of establishing African Association of Pharmacy Schools, it is a very welcome development for us. It also will facilitate engagement, because if we engage with one institution is easier to interact, and then you can disseminate your member countries. And I think an added value of that would be that this association, because hitherto, as you have already said, Pharmacy has been discussed in the context of medical and dental institutions. So focusing on pharmacy will be helpful for you to really focus on the issues that have already been discussed. It will also provide opportunities, I think, for harmonizing of competence-based curricula that you've already talked about, to ensure that there's common standards that you were alluding to. Promoting contributions of pharmacy to the universal coverage and people-centered care. A balance between profession as the profession and also linking to the people-centered care that the standard declaration that you mentioned alludes to, and universal coverage. And also, I think the added value of the association will be advocating for increased teaching and learning capacities that you already talked to in the report. Regarding the expanding of your UNITWIN program, we applaud that the excellence in pharmacy education and international cooperation and networking between universities be promoted through this program. My main comment I have on this is that while you are targeting to expand to other regions, maybe you can also expand within the region. And I like the comment of inclusiveness of language access as well. That would be very helpful. And so for us, 47 countries, if I add colleagues in the EMRO region for the continent, I think that would be very helpful. Overall, Chair, I think the issues that are raised in the report are very important, and as a region, as WHO, some of the common things that are consistent with our strategies, we can work together and see how countries can implement the issues of professional education, skill mix, and fit for purpose agenda, issues of addressing, managing the migration of health personnel at selection level students in the context of education. That is what this health education, in my view, can start. Because if you start with those, targeting those students whom will be dedicated to serve in those areas, you can begin to address that aspect in this context. The ensuring PHC approach and universal health coverage to meet health needs of the population beyond the capital and commercial cities. I think it's something that as Africa we need to do, because our populations suffer because of where they are situated. And as you have said in this COVID access, I think we are very blessed that so far the situation in our continent has been better than most in other continents. But can you imagine if the effect was like another region? One quick example I can tell you: 60% of maternal services were brought to a halt because of lack of expertise who are repurposed to COVID. And I'm sure you have your own figures for the pharmacy personnel in terms of dealing with the treatment and so on. So accessing actual needs of the workforce, including the pharmacists, is very important for us. And the overall, to support countries in strengthening these capacities in the health science programs that produce the health workers who are skilled, competent, and fit for purpose. And I like the strategy of postgraduate programs and targeting community access and putting the people at the center of it all, so that in the end, our populations get the same standard and quality of care that any human being is entitled to as a human rights need. So, Chair, thank you so much. We look forward to reading the report and seeing what are common elements that we can interact and assist you to advocate in countries from our comparative advantage. Thank you so much. Over to you.
So thank you, Jennifer, and thank you all members of the panel for your very, very wise words for us as we continue our work going forward in the center program and the UNITWIN program. And I am certain we'll be knocking on your doors as we make progress in all of these various areas that have been talked about, and in particular this African Association. Nilhan, do we have questions for our panelists?
We actually received one question during the part one, but I think that question can be transferred to this panel as well. Okay. And that question was about, we discussed how we may advance pharmacy education and our profession in each country and across the continent. And the question was about how pharmacists were consulted or were involved with the government when national strategies were being set up for healthcare, for workforce, for education. So the participants are curious to know if our panelists have some examples that they could share from even from the continent or in their country on how pharmacists were involved and contributed to these national strategies. This is something we also emphasize for the importance, for its importance in our findings. So that was one major question to the panel.
Okay.
Any colleague who would like to respond to that from the panel, or even also our speakers, not just the panel, but we can open the floor to everyone as part of our Q&A today.
Jonah, do I understand you to say, to be asking us, are pharmacists consulted in national strategies?
Yes, that's the question.
Yes. If you look here, for instance, the Ghana National Drugs Program is led by pharmacists. This is the group that brings doctors and pharmacists together to develop the national treatment guidelines to guide treatment of people outside the teaching hospitals. In the teaching hospitals where you have consultants, they are free to do what they want. But beyond that, I see your look, Joanna, when I say, don't take it literally when I said they're free to do what they want. But it is understood that they are competent enough. But the district hospitals all the way down are required to use the standard treatment guidelines. And that process is led by pharmacists with doctors who they all work together in a team to develop these guidelines. But with other strategies, you have to be proactive. The Pharmaceutical Society and the Pharmacy councils or the equivalents in those countries. The Pharmacy Council, for instance, is under the Ministry of Health, and they meet regularly, control the profession. So in terms of strategies and things that affect health, pharmacists are very much involved. At the moment, at the Ministry of Health, the person who is in charge of all strategies is a pharmacist there, which is a good thing. So I think we're deeply involved.
That's good to hear. It's good news. Does anybody else have experiences like that? Prosper.
Yes. Thank you, Ralph. I wanted to say something about the collaboration with the government, the institutions, and the higher education in a country like mine in Cameroon, where at the time there was a 18 medical school working in bad conditions, and we decided.
I have taken.
Stanley, mute.
I have taken.
Okay.
Okay.
Sorry about that.
Okay. Then we decided at the level of the council, at the level of the National Council of Pharmacies, and the Council of the Medical Council and the Dental Doctor Council also, we decided to meet the Prime Minister to fight against that situation. And in 2013, there was the government decided to put in place a commission with lecturers, with the higher education, medical doctors, pharmacists, to think about the organization of the training of the education of medical doctors, pharmacists, and dental doctors in universities, and reduce the number of schools. Now, we have in Cameroon four pharmacy schools, 3 public and 1 private. Every year we have 100, if every batch is 150 pharmacists. In 5 years, we have registered more than 1,000 new pharmacists. The problem now is to find jobs for that new pharmacists, for these new pharmacists. It is important. The problem of planification, finding jobs for new pharmacists is also another challenge.
That sounds like the next step in your advocacy efforts.
Yes.
Of expanding the scope of practice for pharmacists, because you know, and I know, we all know we're going to need them if we're going to meet universal health coverage and all the things that involves. So yeah, more work to do. That's good. Yeah. So thank you for those comments. It's great. Okay. Any other questions that we have, Nilhan?
We haven't received other questions, but I think this was an important question to discuss, as it's created great awareness. Now I see from the chat that our colleagues will push their efforts in involving, not just getting involved, but making a change by being involved in the policy committees to transform the education and the profession. So as there are no more comments, I will start sharing my screen again to continue to the next part.
Okay, so a couple of announcements of what we need to do next. So as I become the chair of FIP Education starting this last month in September, I'll be stepping down from my role as the global lead for the UNITWIN program, and we'll be putting out a call for nominations in early November for the UNITWIN Global Program Director, as well as regional directors, as both within Africa and as we expand out. In addition to that, and I've heard a lot of support from virtually everybody for this development of the African Association of Pharmacy Schools. And so we will be forming a task force to work on the all aspects of the design and development of that association. So keep your eyes open for the call for volunteers to be part of that task force. I believe that this task force needs to involve certainly people on this call, our speakers, our panelists, and so forth from Africa, but I also think we're going to need some external input from those who are parts of these other associations around the world that could give us great insight into developing this association and making it sustainable. So we'll look for those two calls coming up in the next month. Now, finally, I would like to give my huge thanks to everyone for their superb contributions to this report, to this event, to the wise comments and areas that were brought up by our panelists that we need to make sure we focus on and continue the good work that's been started. And the tribute to those who are our founding members and our former leaders. So we never do anything on our own. We're all working together, and we're all standing on the shoulders of those who came before us. So thank you to all of those, as Muhammad mentioned. And thank you also for our audience, many of you who have remained on this event up until now. I know we're running over, so appreciate you and your questions and your input. So again, thanks to everyone involved in this great event today and all that went into making it happen. And Nilhan, I think I'm moving it over to you for final comments.
Thank you, Ralph. Again, I'll just echo Ralph's words. It's been a pleasure today to have this conversation. I want to thank our speakers, our panelists, and also all participants that stayed with us for 2 hours today. I think we always kept the excitement at the top level. So we are really, really enthusiastic to see your comments, your interest. And we count on you, on your leadership to progress these findings together. So with these powerful messages, we will wrap up today's episode. I wish we could stay more. There are many things to discuss, but this is not one and only. So our work starts exactly now with the launch of this report. Again, I would like to sincerely thank our chair, speakers, my co-facilitator, Ellison, for an excellent session. And of course, to you, our participants, for joining us from all around the world today, not Africa. That was one of the best parts of this event. We have seen that the challenges are similar all around the world, and FIP commits to tackle these challenges with you through the FIP-UNESCO UNITWIN expansion. I invite you all to visit our repository. Again, I share the link here, and you may also scan the QR code to go to the page directly, to download the report, to join the conversation on the report's finding. Your contribution is what's going to make this report work. And if you have any questions and comments, please always contact us at education@fip.org. Thank you for your support. Thank you for your leadership in the mission to catalyze change for advancing pharmacy education across Africa and beyond. Have a nice day, have a nice afternoon, and have a nice evening. Thank you from FIP.
Thank you all.
Thank you.
Bye, everyone.
Great to see everyone. Thank you.
Bye-bye.
Bye, everyone.
Bye-bye.
Bye, everyone.
Bye-bye. We'll see you next time.
Bye-bye.
Bye-bye.
Bye.
Bye.
Thank you, colleagues.